Thanks for the opportunity to come along. I'm hoping that I might answer a few of the questions to the last speaker because I come from the northern region and we do things maybe a bit differently there than we do down here. So who am I? I am currently the consumer member of the Cancer Governance Board for the Northern Region. I'm the Secretary of the Breast Cancer Aotearoa Coalition. Now, like Ted in the video a bit earlier, I clearly remember the 11 o'clock on the 16th of June 2005. It was when I was diagnosed with breast cancer. Anyway, a few years later, I thought that it was time to give something back. I'm a lawyer by occupation. I run the business, as Chris says. And I thought that that was a good thing for me personally, but just if I could make things better for other women or men, as it turns out as well, that's a good thing. Now, the Breast Cancer Aotearoa Coalition, I've got to say, a bit of promotion here, they provide support for women with breast cancer, and not only a step-by-step information pack, but they also do web videos on their website, and that includes not only the women themselves and a man, but also health professionals. So what we've done to get information out there is to actually provide, you can go to the website and you just don't hear about other patient stories, but you actually hear from health professionals, and there's a range of them, a radiologist, an oncologist, etc., and they're very helpful. I am also the chair of the Northern Cancer Network Consumer Group. Now, the Northern Cancer Network covers the Northern DHBs, Northland Counties, Waitemata and Auckland. We have a consumer reference group. It gives advice to the network with regard to cancer and their programs. So I chair it. We have, we've got lung, bowel, brain, various tumour groups all represented, and we meet about every quarter and we give advice to the network with regard to their programs. We get a bit of feedback from them about what they're doing, we give them a few ideas. Some of our members become involved in tumour groups. In particular, actually, just to call on some of the other words that we used today, this morning, hope. We did a lot of work with the care coordination plan for the Northern region, and the message of hope, that was our big thing as consumers, and I'd like to think that it's made quite a bit of difference to the way cancer patients or cancer services are delivered. I have been on a national consumer group. I have been on the Waitemata Cancer Control Steering Group, and I have been a past member of ProCare's Health Clinical Governance Committee. And I saw Lynn down here. We're on the plane together apparently, but we didn't see each other. We both used to get up at 7 o'clock in the morning. She still does, and talk to them. ProCare Health, it has, I think, more practices under it than any other PHO in the country, about 400 practices, or 400 doctors, something like that. Anyway, it's very much deals with their programs. Now, I've just popped up this slide. Apologies if you've seen it before. And it really is to say we all see the world through different eyes. Now, if this was my daughter looking at this, she'd probably say, cool blouse, I wonder where she got it. And for me, I just could never look that good, not at my age. Now, so when you look at this picture, you see it differently, because we all, depending on our experiences, we see the world differently, and we see health services differently, and we have different demands. So I don't know who saw the dog driving the car, but I bet not many of you, okay? So I won't ask for a show of hands because I know no one will have seen it. Next slide really is how you can be involved in cancer, because cancer is really the thing that I know most about. You can be volunteer workers, you can be in support groups, you can be on cancer committees within DHBs. At the moment, our 4 northern DHBs have cancer control groups. They're required to do so, and I've been a bit like a stuck wheel, to be fair, over the years, because I've been around it for a bit, and I've asked them if they had a consumer on. Now, counties have for ages, Auckland have, Waitemata have, and Northland are just getting there. So hopefully Northland will get there. I'm just hoping, really. Then there are the national and regional tumour groups and advisory groups, and there are heaps of those. Not only are there heaps of those, they're changing all the time. So you might be on one thing, and then next thing you know, there's a ministerial directive and there's another one. You know, they're just always changing. So if you want to be a consumer, it's helpful if you know a bit about the health system, and it is really, really difficult. Just tell you what the Cancer Governance Board is about. It is now the board that they've got reasonably, I think it was set up last year, to look over cancer in the northern region. It's responsible for cancer services. And I went to the inaugural meeting. At that meeting we looked about and we said, well, we don't want this to be a talk fest. We actually have to do something. We have to do something for our patients. We've got our population, sort of about 40% of New Zealand live up here. We've got to do this properly. So we discussed who was going to be there. And so our chair is the CMO, the Chief Medical Officer of Waitemata. Our deputy chair is Elsa Clare. She's the CEO at Auckland. We've got someone, I think the deputy chair at Counties. We've got planning and funding from Northland. We've got the cancer person from each DHB. We have a nurse. I've got to say that was a giant step forward, that we have a nurse practitioner, the head nurse, on the board, because it seemed to be essential, and I don't know that that's always been the way. So that's very good. We've got a consumer, that's me, and we've got Māori representation as well. So to be a consumer at governance level, it's you need a few skills, and there's a bit of work to be done. And what do you need to know? Well, for a start, we've heard about, I can't remember what they were called, what was partnership again? It was something or other. But there's acronyms, they're everywhere around health. And what's more, not only are there acronyms, but there are phrases. When I came into cancer, there was better, sooner, more convenient. Then there was faster cancer treatment, and in the board papers I saw last week, it's next from October, it will be faster tests and cancer treatment, so that's going to be a new one. So the health system, as you all know, it's ever changing, so for a consumer that's quite demanding. How are you ever going to know? So at governance level, consumers, they need to know the language, okay? They need to know about the health system, and you've got to bear in mind that really for their treatment, they've probably only seen it from a fairly limited point of view. The health system, as you all know, I've been looking around it, we've got a wonderful group of people here coming from all over, all involved in different aspects of the health system. How would you ever know? You only see a tiny part. And also at governance, discussions are different than they are at other levels. You know, when we're at our consumer reference group, we're making recommendations, we're telling people what we would like to see, we're making suggestions of how things could be done differently. At governance level, it's different. You're actually making the decisions. And, you know, there's a few doctors in the room, I've said, and at governance level, and it's not a problem for me particularly, but I've got to say that I don't see that as being necessarily the same right through. You know, it's just like all people can't be at governance level, all consumers can't either. But if you want to make a contribution, there's a lot of ways to do it. What I find actually quite interesting is when you go to a meeting and everyone else knows each other, but they don't know you, actually, so they don't talk to you much either. And what I also have found, because I've been around the traps now for a while, is that those people change. So that they all still know each other, but actually they don't realise that you've been there for quite a long time and you have quite a lot of knowledge. For example, I think on the Cancer Governance Board at the moment, only the clinical director and myself were there about 3 years ago because the staff changes. So what do? We share our insights. I think you sort of probably got that from that picture before. We do see things differently. And often I've heard, you know, when I've been talking to people, you know, well, we don't need a consumer because we're all consumers. Well, what a lot of nonsense this is. And I actually used the word nonsense because Chris told me that it was being filmed and would be on the website, so I use it nonsense. Now, I've got to say, last year I went on holiday and I broke my leg really badly, and I had to be in a wheelchair, and I couldn't walk and I couldn't drive. And I found at that time that people stopped talking to me. They only talked to my husband, who was pushing the wheelchair. Apparently, I didn't understand. And then also, not only that, when they did talk to me, they shouted. So I actually got to be deaf as well. So I thought to myself, you know, Then I started to try and walk, and then I saw where there were steps and when there weren't steps, and I had to really plan my day, particularly when you go into a meeting in one of these buildings in downtown Auckland. It's got one of those revolving doors. Have you seen them? And you had to sort of time it with your crutches to get there just in time so that you weren't sort of going to be stuck going round and round and round and never able to get up. It was just awful. Anyway, as I say, I think that until you have an experience, you can't understand it, and for a lot of the things that we deal with, particularly in cancer, you don't want anyone to have that experience. So there's a lot of work done on screening and detection and what have you. Now, having said that, I think that when consumers are appointed or when they make a contribution, they've actually got to make a contribution on something that is relevant to their experience. Yes, I do say here that I think it's important at governance level that all members actually bring something to the table. I think often you have a table and you've got a lot of people and no consumers, but actually people are very careful about what that consumer can bring to the table, but they're not really looking at themselves and what they might have an experience of life, obviously they're alive, but they actually need to give something to that particular organisation, and I just don't see why people pick on consumers particularly. Consumers will raise issues that are important to them. They will know we've just heard about the masks for radiation, and I think that's a really good one. I think I was at Auckland at the DHB when one of the lands was opened sort of by the Minister a few years ago, and we did a bit of a tour, and I'm pretty sure they've done some work on radiation masks there, particularly for children. I mean, you have to be very, very still, and I think anyone, if you've had radiation, and I have, you have to be really, really still, and because you don't want it, in my case, to go into your heart, okay, or your lungs, because that's not good, and going into your spine and your brains, they've just got to go to the right place. I think myself, it doesn't matter what you're doing, that a range of views is really important. You don't actually have to agree with everyone all of the time. And I'm sort of a bit 50-50 on compromises too, and consensus. I'm not going to be very popular saying that, but I think that sometimes people have to be held to account. And I know that when I run my business with my partner, we have a range of views too, and we're making a decision. And Sandy, she has a different view to me and I have another view. What we decide to do is not to go with a consensus or a compromise that neither of us are happy with. We go with the view of one of us, and then they have to stand behind that view. So I think sometimes when I'm on these governance boards, I try to, if I've got a view, express it. But at the end of the day, I'd rather that the others have their say and we see how it goes and then reevaluate, than have some mishmash that no one was ever happy with and no one would take accounting for, because they'd say, well, it wasn't mine, I didn't want to do that anyway. And you sort of get everyone sitting around the table saying, well, we didn't want to do any of that anyhow. But I guess that comes back to evaluation, which is really, really important. I thought I'd just quickly say about, Lynn can chip in here, the differences between primary and secondary care governance. At primary care level, when I was asked to be on the Clinical Governance Committee of ProCare Health, they mainly look at standards and programs to improve care to their population. And I went along to an induction morning to familiarise me with what they did, what their programs were, what they expected of me, so that when I went at 7 o'clock in the morning the next week for their meeting, I knew what was all. Obviously, I had the agenda, I'd read it. I knew what they expected from me, and it was a very, very satisfactory experience, and I just really couldn't keep on doing it because I had too much else on. But you felt like you were having some form of impact. Secondary care seems to me that it's, and I might be wrong here, but it seems to be very much driven by ministers' priorities and budget concerns. And I guess I take the point that you've got to get value for your money, and I think that's what we all want to do. We're all taxpayers here. However, training, I think, of consumers in cancer or wherever in the health system, I think is incredibly important. there hasn't been much. We started to do some in the northern region, and I think in the southern region they're doing some in cancer, and it's been fabulously received. It's just that we don't have enough people. Because I think if we can get good training, firstly we need to get the people. I did pop in here a little case study, which is really an issue which in 2008 the northern region had decided on a policy in respect of IV chemo drugs, and the policy is, and I'm not going to labour this, it's that if you want to top your funded drug up with an unfunded drug, you can't go into a hospital, get your funded drug and then go off to private. You've actually got to go to private and you've got to pay for the lot. Now, consumers in the northern region anyway don't like that. And anyway, it's back on the table. So I'm not sure what will happen about it, but it's one of those issues where that consumers have raised all by themselves. So, consumers, better decisions at all levels. And I would say there is no justification for leaving consumers out where they are central to the process. The problem that we've got in cancer is it's difficult to recruit people as consumers. Looking back, remembering your life-threatening disease, which they all are, and your treatment, and then putting your mind towards service and policy improvements are difficult tasks. So we're not talking about support groups and what have you, we're actually talking about service improvement and policy improvement. And even worse still, actually, unfortunately, what happens is some of the members of your committees don't do so well. And that is an extremely sad experience. They're people that you come to be friends with, and they don't do so well. It's just another thing that makes it difficult for people to want to put their hand up. Okay, so I think that in the northern region people do appreciate that it's a difficult task. However, at the end of the day, I'm not sure how we're going to do it, but we need to have better service delivery from more people, more consumers at the table. They have a different look at things. They have good ideas. Those good ideas don't always cost a lot, and actually some of the good ideas actually save money. In line with a bit of the theme from today, my view is that better service delivery comes from consumers being at the table at the time, but I think it also comes from consumers being at all of the tables all of the time. And you'll probably all be familiar with that saying, nothing about us without us. But I think with our health system we have at the moment, it's never more true. That's it.